Imagine a future where our healthcare professionals could prevent us from falling ill in a way that naturally fits within our lifestyles. In doing so, we could realize $200 billion in value between now and 2030 simply by bringing dark data to the hyper-personalization of medicine. Hyper-personalization is a way of providing very targeted offerings of products or services based on the past history of someone. We can bring hyper-personalization to healthcare by taking the clinical data that's normally captured by healthcare professionals and combining it with dark data, meaning data that's collected but not normally used for the purposes of healthcare. So as individuals, we generate various amounts of dark data, and we're in control of that information, whether it's credit card transactions or the places that I travel to or the type of exercise that I get or the foods that I eat. That data is still under our control. And by granting access of that dark data to our healthcare providers or even just a healthcare app, healthcare professionals have a much more holistic view of an individual and their entire lifestyle, so that they can provide much more precise treatment and advice to them to prevent illness and to keep them healthy. One example of using non-clinical dark data in healthcare is to provide proactive treatment. For example, if I'm traveling to a city that is undergoing a very high pollen count and I have hay fever and I will have an allergic reaction to that environment, I could have an app on my smartphone that notifies me that I'm traveling into that environment and could suggest various treatments, antihistamines for me to take or to bring with me proactively to ensure that I don't suffer the effects from those conditions. By using hyper-personalized healthcare to eliminate illnesses, we could save about 200 million sick days, and that's a lot more healthier time for employees and a lot more productivity for businesses.